Hi guys, it's Marissa with Sports Performance Physical Therapy. And what we are talking about today is sciatica. I'm going to share with you 6 things that you need to know about sciatica, because I'm sure some of you are wondering kind of what is it, what can I do about it? Is physical therapy helpful? So, number 1, first thing is that sciatica is not permanent and that it can heal. Usually about 75% of cases are going to resolve within a month. And if you think like, that's too long for me, or I think I need surgery right now, I would encourage you to kind of hold off on that. Because around like 6 to 12 months, people that have had surgery end up with about the same outcomes as people that didn't have surgery. So try not to get cut open if you can avoid it. Number 2 is going to be that rest and stretching might not be your best go-tos if you're dealing with sciatica symptoms. So if you're laying around in bed resting, what you're going to end up getting is a little bit of muscle stiffness. And you don't necessarily want to be super stiff when you do end up getting out of bed if you have to go to the bathroom or something. So you want to be able to be a little bit loose as far as your muscles go. Also, you're missing out on the pain-relieving benefits of movement, and you're not really getting on with your daily life if you are sitting and laying in bed. So try to keep moving if you're dealing with sciatica symptoms. As for the stretching, sometimes stretching doesn't always feel super great for sciatica, and that's usually because you get a little bit of tightness in the muscles in the back, and if you try to stretch that, sometimes that can further worsen a nerve that's compressed if it's back in your glute. And so stretching that might not feel so great. So again, try to get moving. Don't stretch if it doesn't feel good for you. Number 4 is going to be that sciatica feels a little bit different to different people. So some people will have burning, numbness, tingling, cramping down the back of their leg and it stops at their knee. And other people are going to have those same symptoms, possible tingling, shooting pain, stabbing pain, anything that goes all the way down the back of the leg and possibly down into the foot. So don't just think that sciatica is going to stop at your knee. Don't be surprised if it's all the way down to your foot as well. Number 5, sciatica can come from 2 different places. First one's going to be your glutes, right? So if you've got a nerve that's kind of a little bit pinched in through here, that would be symptoms that come from your glutes. Otherwise, you can get some compression a little bit higher up, and it could be coming from your low back. So if you're not sure which one of those is contributing to your symptoms, then you might want to check out a physical therapist, and they can probably help you out with that. And last one, number 6, is that your posture can possibly change your symptoms for sciatica. So if you're sitting and you're getting really uncomfortable, you can either try arching your back, all right, changing up your posture a little bit, or what you can do is try offloading the hip that's bothering you. That can help temporarily, but again, your long-term fix is going to be to keep moving, and hopefully you won't get stiff and you won't be in one position for too long with aggravated symptoms. Other than that, check us out at Sports Performance PT on Instagram and online. If you have any more questions about sciatica, feel free to give us a shout.